Hi, my name is Daphne James. I am a family nurse practitioner and also a DNP student. I am here to present the Extreme Makeover presentation for NU 713, Organizational and System Leadership for the Advanced Practice Nurse. This is the table of content. Introduction and learning outcome. We will discuss a case about a patient who presented to the clinic with suicide ideation and how the event was miscommunicated. We will look at the ways to improve the specific event by using pattern of relating, pattern of meaning, ways of talking, ways of being, innovation, and improving the event. A patient presented to the clerk's window stating that he was having suicidal thoughts and that he needed help. The clerk called the nurse on duty but did not receive an answer. So the clerk told the patient to sit in the lobby. The clerk was relatively new and frustrated because she did not know what to do. The clerk who was supposed to train her called in sick for the week. The clinic got extremely busy, so the patient walked outside to smoke a cigarette. As he was smoking, he saw a friend he knew, and the patient told his friend what was happening and said that the clerk brushed him off. The friend immediately went to the patient advocate office and explained the situation. The advocate contacted the clinic, and the clerk immediately knew what the patient advocate was inquiring about. The advocate told the man to get his friend and take him back to the clinic. The patient friend went outside to return the patient to the clinic. The clerk told the patient to sit in the waiting room again until the nurse called his name. Approximately 35 minutes later, the nurse triaged him. The nurse contacted the on call psychiatrist. The nurse called a nursing assistant to sit with the patient until the ambulance transferred the patient. After the patient was on the unit for over 24 hours, the attending psychiatrist on the inpatient unit noted, noticed that the patient had not been medically cleared and he was diagnosed with diabetes and went without insulin for a day. The patient was stable enough to be treated on the unit, but it caused a lot of unanswered questions and confusion, which caused several staff members to be disciplined. When the patient was questioned, he said he felt no one cared. He indicated that he was dissatisfied with his service and treatment. Miscommunication in healthcare, failure to communicate critical information such as medical clearance, being a diabetic, and suicidal caused a lack of treatment. The clerk did not provide information from the chart to be transferred to the accepting facility. Poor communication between discipline due to not knowing what to do. Physician do not want to communicate with nurse and nurse practitioner when there is no medical physician available. The results in fragmented care and delay in treatment and misinformation. Communication breakdown during emergency could cause a catastrophic event or mortality. Incomplete or inaccurate handoff. The patient was transferred with incomplete communication, leading to the important information being lost and not monitored. Themes of conversation. Inadequate staffing and increased patient load negatively impacts the quality of patient care, resulting in a culture of frustration and feeling overwhelmed. Lack of and insufficient communication can lead to misunderstanding of roles, responsibility, or expectation. This usually results in confusion, lack of quality care, low productivity, and low morale. Lack of transparency. Employees feel that they can't talk to their supervisor or physician without feeling less than, unsupported, and appreciative. Lack of training due to lack of staffing. New employees are being pushed out of orientation in less than a week when they're supposed to have 1 month of orientation and 3 months of shadowing their mentor. High turnover rate. Employees feeling burned out, undervalued. They feel like the organization is requiring staff to do more with less without being appreciative or time off. Employees is becoming more dissatisfied with job assignment and they feel a lack of growth and development in the organization. Here's organizational perspective, which is the organization is hierarchical, meaning top down. Organizational conversation. We will learn the difference between patterns of meaning versus pattern of relate. Pattern of meaning. refers to recurring themes found within the exchange of information between individuals or organization. As we reflect to the scenario, the organization's mission is serve to improve the health of our patients and ensure patient first. The suicidal patient safety was not put first. No protocol or effective communication existed while dealing with this crisis. Vision to be the provider of choice in West Alabama. Patient stated he felt no one cared and the clerk brushed him off. Customer survey also reflected when he left that the patient was dissatisfied with his care and would not refer friends or family to the facility. Value. We are compassionate, accountable, and engaged. The organization was too busy to show compassion. They also lacked accountability and engagement. The clerk was basically lost. She allowed a suicide patient to leave unattended. It was lack of communication by all disciplines. Pattern of relating, how we interact with each other. The clerk did not start the admission process. If she would have looked into the electronic health record, she would have saw that this patient was flagged with a high risk of suicidal and to contact security and nurse immediately if he presented to the clinic. It was a delay in transfer because accepting facility needed insurance because different facilities accept certain insurance. And if they did not have insurance, they had to see a social worker as an indigent patient to receive a grant for admission. The advocate should also had contacted the security and she should have went with the patient friends to find him outside to ensure that he was safe and still in the facility or on the facility grounds. The nurse and clerk should have a better way of communicating, such as beeper, intercom, or either personal phone number. The referring provider did not receive sufficient report of patient medical history causing a lack of treatment, not receiving insulin for 24 hours, and the wrong diet. Transfer delayed due to waiting on insurance before the ambulance could be called for transfer, resulting in the attending and referring facility staff being disciplined. Relational leading. The healthcare staff would appreciate and want to see supervisors and physicians actively listening to them when it comes to patient care and staffing. Better collaboration, connectivity. Staff want to feel part of a team and value. Remember, there's no I in team. Empowering others instead of blaming when things go wrong. They want to be able to learn from their mistake and allow it to be a teachable moment instead of punishment. Ways of talking. Ways of communicating by listening, which is crucial for effective verbal communication. Opportunity to engage in discussion, allow individuals to exchange ideas, share perspective, gather information from others to make the organization better. Attended training to stay abreast of current and updated topic changes and learn from expert and peers. Reinforce existing organization mission, value, to remind employees what drives them every day at work. Ways of listening. Active listening is good eye contact, nodding, verbal cues shows that you are paying attention and understand. Collaborative process is open communication, shared goals, trust and respect. Paying attention to the patient or employee's body language, facial expression, and tone of voice. It can provide insight and context to the message. Paying attention to the conversation, avoiding distraction or interruption. Being present and aware describes as being meaningful. Innovation, as defined by Castaneda and Kuehler. Innovation is acquired, shared, and assimilated to create a new knowledge that embodies products and services. Strength of innovation bring individuals together to share knowledge to improve treatment that enhance patient care, alleviate symptoms, and improve overall quality of care. Data analytic and modeling can analyze big data to identify trends, patterns, risk factors, resources allocation, and inform decision. Barriers of innovation, resistant to change. Individuals and organizations may resist change or new ideas due to the unknown or fear, lack of resources, lack of collaboration. We will rewrite the story. A suicide patient presented to the outpatient clinic with active intention and thoughts to harm himself. He explained to the clerk at the window that he was having suicidal thoughts and that he needed help. The clerk excused himself from the other patient, listened to the patient, and acted immediately by placing the patient in a private room. Beat the psychiatric team and Skyped the nurse on the unit. She used the computer to process insurance and paperwork for the accepting facility. The beeper number for the psychiatric team would notify a psychiatric nurse, psychiatrist, and security. The nurse was busy with another patient, therefore, security stayed with the patient on one-to-one until the nurse and the psychiatrist came to the unit. When the nurse arrived, she assessed the patient, informed the psychiatrist that the patient needed an inpatient stay, and informed the psychiatrist that he would need medical clearance. As a family psychiatric nurse, I obtained a full H&P, obtained labs, COVID testing, and ordered necessary medication for the patient. I collaborated with the psychiatrist to inform him that the patient was medically clear. Then I contacted the attending medical provider to provide a report. I informed the medical provider that this patient was a diabetic and he was non-compliant to insulin. Blood sugar was above 300, and I ordered stat insulin before he was transferred to the inpatient facility along with the diabetic snack. Improvement of communication. Pattern of relate demonstrate excellent communication skills among discipline. Clerk utilized the electronic health records to start the admission process. They was able to communicate by phone, Skype, and intercom. Appropriate transfer paperwork and communication improve handoff to the referring facility and appropriate treatment for the diabetics. Pattern of meaning. The staff exemplified the organization mission, value, and vision. The mission, patient first. The clerk and the staff understood the urgency of the patient's suicidal thoughts, which ensured the safety of the patient. Ways of listening. All discipline was actively listening and able to hear and understand the urgency of the patient situation. Good collaborative process, open communication, shared goals, gesture and response, paying attention to the patient and employee body language, facial expression, and tone of voice can help with insight and context to the message. All discipline paid attention to the conversation by avoiding distraction and interruptions. Reflection. Communication is directional, identifying the problems and being able to resolve conflict by pattern of meaning, pattern of relating, ways of talking, ways of listening, innovation, shared knowledge and idea to improve patient care. Use of effective technology. Since the incident, the clinic has invested in smart badges, making it easy for people to find each other and communicate quickly, enable people to communicate safely and effectively during hands-on patient care flow, assist worker to reach help quickly in an emergency. Here is the reference, and thank you for listening to my presentation.